Alexis Sykes. I am going to be inserting an NG tube on the patient according to the doctor's order. And for suction is the purpose of the nasogastric tube insertion. And now I am going to, I did my hand hygiene, and I'm going to, with my pen light, assess the patient's nares. Okay, and I'm going to include one nare, sniff for me. Okay, sniff. Okay, both the nares are piercing, and I'm going to check the oral cavity of the patient. Everything seems good. Now I am going to apply my gloves. I already did my hand hygiene. Now I'm going to measure my NG tube from the tip of the patient's nose to the back of the ear down to the xiphoid process. And I'm going to use tape to measure my marker. Okay, and now I am going to lube my patient, and I'm making sure my patient is in a high phallus position. I'm going to put the towel over my patient, and now I'm going to make sure my tube is lubed for 4 inches, and I'm going to give the patient a cup of water to assist in the process. Okay. And so I am going to tell the patient to pull his head backwards, and I'm going to make sure all of this is coiled and good. Well, not coiled. And so I'm going to start inserting the tube into the nares. I'm going to slowly insert. And then I'm going to, then once I reach the back of the throat, I am going to stop, and I'm going to inspect and make sure the tube is not coiled, and it is not coiled, and so I'm going to proceed with insertion. And this is where I will tell the patient to sip some water, and I'm going to lift his head forward first, and then I will tell the patient to sip and insert the tube. So swallow, insert, swallow, insert. So head is forward, and he's going to swallow, and I'm going to slowly advance the tube. And while I'm doing that, and if the patient at any point in time gags or cough, I will slowly back up the tube like an inch and let the patient recollect himself and slow down and catch his breath. And then I will further advance the tube until I reach. Okay. So I'm inserting it this way, and I reach my marker, and I am going to now temporarily tape the tube to the nose. Okay, so it's in there, and I'm going to, I temporarily tape the tube, and now I'm going to verify placement. I'm going to ask the patient to speak, and then I am going to aspirate the gastric content, or to make sure it's gastric content. I'm going to apply my syringe, and I'm going to aspirate and make sure I get the gastric content, and then I'm going to listen at the stomach in the left upper quadrant. And I'm going to, while I listen, I am going to push back the gastric content. Okay, and I hear a bubbly gurgling noise, so it's in the right place. And now I'm going to disconnect this, and I'm going to send the patient off for X-ray tube for a further permanent placement. And then the patient will come back after they verify the placement, and I will permanently, I will retape the nose and make sure it is on properly so it doesn't come off. And then I will have removed the towel, and I'm going to attach the tube to the gown so that the gown won't get snagged or pulled anyway with the rubber band and the safety pin. Okay, and after that, I would clean my area, wash my hands, and I would document what I did. I would document the NG tube, the date and the time, the type of tube that was inserted, and the color and consistency of the drainage, and the client's response to the NG tube placement, and the any teachings or instructions that were given to the patient. And also, I would measure the intake and output for the INO record, and the and also I would, if the hospital wanted me to test the pH of the gastric contact, I would use litmus paper, and I will also record that as well in my documentation. And I would also like to state that after I had verified the placement of the NG tube, I would attach the tube to the suction in a low intermittent setting. Thank you. Hi, okay, so I'm back in the patient's room doing the irrigation of the NG tube. So I washed my hands and did my hand hygiene and make sure the patient is in a high Fowler's position. And I'm going to put the towel back on to the patient, and I'm going to detach. First, before I do that, I'm going to apply my gloves. So now I'm going to detach the tube from the suction, and I'm just going to, before I irrigate, I'm going to verify the placement of the tube by attaching the syringe and aspirating for gastric content, and I have received the proper gastric content, and now I'm going to listen with my stethoscope, the stomach in the left upper quadrant. And I'm going to listen and push the content back into the stomach. Okay, it's still in proper placement. So now I'm going to start the irrigation process. So I'm going to drop 30 ml of saline or sterile water. And I'm going to insert it into the tube. And now I'm going to pull back 30 ml, well, hopefully 30 ml. Okay, and I received 30 ml of that. And so now I'm going to waste this. And I would attach the tube back to the suction in a low intermittent setting, and I would discard my gloves, and I would wash my hands. And then I will go to the documentation portion, and I would chart the type and the amount of irrigation solution, the difference between the volume of that I put in and I received back, and the characteristics of the return solution, and any difficulty that may have happened while I was irrigating, and I record the client's response to the irrigation, and I would report any teachings that I may have given the patient at the time.